farmhand hygiene real quick. Hi, Mr. Campbell. My name is Megan. I'm your student nurse today. Could you give me your full name and date of birth? Bracelet, full privacy. Okay. So today we're going to be changing your wound or your bandage on your wound. We're going to be cleaning that out just to make sure it stays sterile. Do you have any questions for me? Are you in any pain? No? Okay, awesome. Okay, so I'm going to expose the area and probably a little bit more just because I want to make sure we stay sterile and keep the bacteria out. So, here we go. I might do it a lot actually, honestly. Okay, now I'm going to set up my sterile field. Let me know if you have any questions. Oh, and I would have cleaned the table before. Giving myself a little extra room for the gloves. And then I would lift this, pour it in here. Okay, and then throw that away. And then now I'm gonna put on a pair of clean gloves. I'll just perform hand hygiene. And I would have got, well, I could do my tape now, but I kind of already got my tape out too. Okay, now we're going to take your bandage off. And then take a look at it. It looks clear, there's no blood or discharge on it. So I don't turn my back. Sorry. Okay. Then I will also look at the wound. Inspect it, palpate. Is there any tenderness or pain? Looks like there's 7 stitches. Okay. So I'm gonna take these off real quick. Perform hand hygiene. It's stretching it. Okay. Put on sterile gloves. Don't lose my glove. I don't have them on all the way, but it's usually how it happens. They're really sticky. Okay. So I'm gonna make a little thing so my glove doesn't touch it. So top to bottom. Get it wet. Go on the outside. I'll do it on the other side just to make sure. And then I'm going to dry it with I don't have another 2x2, so I'll just dry it. Then we'll apply a 4x4 on it. And then an ABD pad. I'm going to apply one piece of tape and then take my gloves off. It's easier. and write name and initial it, and then I'm gonna perform hand hygiene and just get him comfortable and then clean up. So lower the bed for you. Okay, then I would clean all this up, ask him if he needs anything, and then report SBAR. So I would say to the next nurse, hi Rosie, my name's Megan, I'm the nurse with Mr. Campbell today. I assessed his wound and just did a dressing change on it. I looked at the wound, it looked okay. There wasn't like any edema or pain. He tolerated it well. He came in yesterday for actually a migraine, but then realized he cut himself earlier that night. So they wanted to just make sure the wound was doing okay after that. So I changed it and it looks great. I would recommend just keeping an eye on the wound and also doing a dressing change every shift.